So, Nadira, thank you for coming here. And I know that you've just had an implantable loop recorder implant. And my question to you is, why are you having this implant?
So I've been having symptoms over the last year or so where my heart's going fluctuating, I'm having palpitations. But for me, every time I go to A&E, you don't seem to capture it in time because the symptoms go. So sometimes it can last for a few seconds or a few minutes, or it could be longer. So yes, I've been having ongoing symptoms with palpitations.
So, I understand you've had palpitations as you described, but have you actually lost consciousness?
Yeah, so I've had episodes where I've collapsed and it just come on suddenly. I'll be walking and then just out of the blue, no warning, and I just faint. Sometimes I do feel symptomatic where I feel a bit woozy, I feel a bit lightheaded, and I do get that flutter feeling prior, but majority of the collapses I've had no symptoms and it's just all sudden.
So, I understand your initial experience of a loop recorder implant was done elsewhere in a different hospital, and that you explained that you had collapsed after a period of palpitations. What was the experience like having the initial loop recorder implant?
Yeah, so I was a bit nervous because I've never gone into a procedure before. That was my first time visiting a cath lab, so I didn't know what to expect. At the time, prior to the procedure, the doctor did explain to me that I would be awake, that they're going to put a bit of local anaesthetic around the area, so I don't feel the incisions when you do implant the recorder. But from prior to going into the cath lab, I went through the consent and the doctor explained to me there can be bruising, or because I'm on a blood thinner medication, there might be risk of bleeding. So, but they said the risk were very quite low and he put me at ease. Going into the procedure, it wasn't like a theatre room, so it was just in a normal room, but obviously there were more people than expected, and they went through the checklist, as in all the health and safety aspect. So the procedure was okay. It took about 20 minutes for it to be completed. The whole process, I was at ease after I had the procedure because it wasn't as bad as I expected. I thought it was going to be more painful and it wasn't. I did feel a bit of tugging. It felt a bit uncomfortable, but I wasn't in any pain. Which was great. Prior to going into the procedure, I thought it would be painful because when someone said they're going to put in recorder right by your heart, you think they're going to cut your chest open, and it wasn't. It was a very small incision, which was great.
So just to try and unpick that process, you went into a room,
Yeah.
and the team spoke with you and gave you what's called informed consent. They told you about the procedure.
Yeah.
Once you were given the local anesthetic for the implant, can you tell us a bit more about what you felt during the procedure?
So once the doctor put the local anaesthetic around the area, he felt a good place to put in the implant.
Yes.
Once they've decided where they were going to put it, they made an incision.
Yes.
It was less than a centimetre or so, very small. It wasn't as big as I thought it would be. And they put the implant in. Also, I don't know if you want me to mention, but they put a drape over you, and there was always a nurse next to me talking me through the next steps, which I thought was quite helpful.
Yeah. That's to keep the whole sterile feel. So, we want to keep this procedure as clean as possible. Yeah. And so when you were lying down, they would have given you a paint, and this can be iodine or chlorhexidine, which really gets rid of all the bugs on your skin. Yeah. And then a sterile drape goes on top. We normally wear a surgical hat, a surgical mask. Yeah. And then we do the procedure exactly as you've said. So after the implant, during the recovery period, how long did they keep you in hospital before you were allowed home?
So the good thing is I was able to go home the same day. Because I didn't have any sedation. I didn't need to have observation at the hospital because it was local anaesthetic, which was great. For me personally, I was able to do my same day-to-day activities, so I was able to work from home that day. They do advise, because there's a dressing on there, to keep it on to just keep an eye on if there's any bleeding for the next 24 hours, keep the dressing on. But they've also advised maybe wait 3 to 4 days to do normal activities like exercise, for example, swimming, if you're quite an athletic person.
Right. So you came in the hospital for the procedure on the same day. You had it done in, say, 20 minutes?
Yeah.
And how long specifically did you have to wait in the waiting room before you were discharged home after the implant?
Yes, I was kept in the waiting room for about 30 minutes just to make sure everything was okay, that there was no bleeding, all the stitches were okay. They did put dissolvable sutures.
Yes.
So I don't need to obviously come back to get them taken out.
So there are two ways to close the wound. Essentially, the wound is 1 centimeter, and the most common way we use is actually to put what's called a Steri-Strip or a surgical plaster. And that surgical plaster just brings the edges of the wound together very nicely before we put a sticky waterproof dressing, which you can shower with. The other way to close, which is much less common, is with a small suture. And that way of closing is normally only used when we're explanting or getting rid of your device. For the implants, we normally use the surgical plaster. You should be able to get back home within an hour, or in most cases half an hour of having the procedure, provided there's no ooze or bleed, and get back to normal activity in terms of walking with modest exertional efforts, but then the exercise you avoid for the next week. So you found it okay? Did you have any bleeding or any other things that you wanted to explain to our audience?
No, so I was quite lucky. I didn't have any bleeding. I'm not in any pain. I do have to mention they do give you like a little leaflet to look out for what signs, if you might have any bleeding or if you're in any pain or if it feels if you feel hot around the area. And the team kindly explained what to look out for and a number to call the team. So it was clear instructions, which was great. So I understood what to look out for if there was any issues, but so far, no issues.
Thank you for sharing your experience. If you were to speak to a patient who is a bit tentative or nervous about having this procedure for the first time, what would you say to this patient?
So I would say it's very beneficial only because they can see continuously what your heart's doing when you do have the symptoms. Honestly, it's not painful at all. They do give you local anesthesia around the area so you don't feel anything. To be honest, the team were great. I'm a person that would like to know what was going on every step of the way.
Good.
And more information, and they do brief you very well so you know what to look out for, so there's no surprises. So I think for me it's a great experience personally. Okay, so we talk about information. You'll know that the loop recorder is an implantable device that sits just underneath your skin, and what it does is it records continuously the beat to beat, every single beat of your heart on a continuous basis. And it has a loop. That means after the memory of 40 minutes is passed, then it loops over the memory. That's why it's called an implantable loop recorder. But you do have a length of time, and the device has two ways of working. Firstly, you can activate the device to store a chunk of the recording with a device, which is what we call a wand, to put to your chest, press a button, and it will store it if anything happens. Let's say you had a faint tomorrow at 3 p.m. On recovery from the faint, you could bring your wand to your chest and store it. But there's a second way that the loop recorder works, and it works by automatically assessing the beat-to-beat variability. And if you have a pause, or if your heart speeds up and goes way too fast in a diagnosis called tachycardia, it will also automatically do a loop recording. So it will store a section of that loop, for us to look at what we can see when we download. Which brings us to the next question. So having had the implant, we now want to talk about how the device connects to our team. How have you found this process of connecting your device to our team members? Yeah, so I've been told the loop recorder that I have now, it connects to your mobile phone, which was my old one. I had a home monitoring device at home. So whenever I felt symptoms, I would obviously press my little wand to activate. And then I would use a little monitor and put it in place where my incision is or where the implant is, and that would send it to the team. Yes. But I believe this new one that I have is a bit different, where it connects to your mobile phone. Yes, so I think in a short while what we'll do is we'll set you up on the mobile phone by getting you to scan a QR code.
But just so that it's clear, the first device that you had, which was implanted elsewhere, that was a device that was coupled with a monitor, which is like a device, like an alarm clock size by your bedside. And as long as you plugged that in and powered it, the monitor itself had its own connectivity SIM card. And so whenever you sleep at night, if you're sleeping in that bed next to the monitor would automatically pick up any of the recordings that were relevant from the previous 24 hours. And this would transmit directly to the cloud to be picked up by your base team. And so in this case, it's us at Imperial, and we would come in, log into the system, and see whether there have been any alerts over the last 24 hours for all our patients. You're absolutely right with this new generation device. Your mobile phone is the monitor. And so we're going to teach you how to set that up in a short while. So Nadira, you've now had the procedure and the loop recorder implant. Have the team explained to you what happens next?
Yeah, so after the procedure, the nurse kindly gave me an envelope. It had like a code on there that identified the implant. So she gave me strict instructions and very clear to call the number and give the code to the operator, and they will be able to connect it onto my mobile phone. They'll be able to tell me over the phone how to use the app, which I think would be beneficial. But for people who might not want to use an app, they do have an option of, which the nurse explained to me, that they can use a home monitoring device that we discussed earlier on to connect the implant. It's all the preference to the patient, so whichever they would prefer.
So Nadira, I'm very, very grateful for your time and kindness in allowing us to record this interview.
Thank
and for you
you
to share your experience with all the patients who will be watching this, tentative and anxious about having a procedure. So thank you so much for taking the time to be with us today.